Welcome back to Stock Painting Snippets. So we talked a lot in the conservative management of autonomic disorders about breathing, and obviously, Boone, you give us Boone's breathing demo in a later video. But can you just talk to us about why breathing works? Is it something that we just say, we say we're stressed, take a breath, breathe? Why does it work? What's the physiological explanation?
I think if we take a step back and think about the autonomic nervous system and the multifaceted outputs and inputs into the autonomic nervous system. So this is that bit of the brain that controls everything we don't have to think about. So gut movement, heart rate, blood pressure control, temperature regulation, sweating, and if we don't think about it, breath and breath rate and breath depth. Now, the breath and the lungs are the only bit of the autonomic nervous system, to my knowledge, that is dual control, or the only bit of our physiology that is under dual control. So if I said to you, Mel, I'm going to move my finger back and forth, this is under my conscious high control. I am asking the finger to move. But if I said to you, Mel, can you move your heart rate up 20 points? How would you do it? You can't will yourself or say heart rate go up 20 points. So that's under subconscious or unconscious autonomic control.
Yeah.
The breath, as we speak now, I'm not focusing on the breath, and so that is autonomically driven or subconsciously driven.
Yeah.
But if I do this now, I'm going to breathe in through my nose, and I'm going to breathe out through my nose, and
you're consciously controlling your breathing.
Exactly. And because there are nerves in the respiratory tree, but also in your diaphragm, which is the muscle of respiration, that take traffic both upwards towards your brain and downwards from your brain, i.e. the effector and effector nerves, we are able to influence our autonomic nervous system with breath physiologically by taking control.
So what you're saying is by consciously controlling our breathing, we can control some of our autonomic responses.
Try it, Mel.
Because of the nerves that go.
So try it. Take your pulse now.
Yeah.
And just be conscious. And all of you watching this now, take your pulse. Generally, you feel your thumb side down. And you take about an inch underneath your thumb side down on your wrist. And you feel your pulse. You don't have to get a rate. You just got to get a regularity and know roughly what rate it is.
So it starts to speed up as I breathe in.
Exactly.
And slows down as I breathe out.
And if you accentuate this by exaggerating on a deep breath in, and if you hold it for a while, so you get a sense of the pulse, and then you breathe out. You really feel into that pulse, understand what it's doing. Any of you at home can do this. You'll find that when you breathe out, you've lowered the pulse rate by 10, 15 beats per minute, sometimes 20. And when you breathe in, you've done the opposite. So that very thing I asked you to do, Mel, can you increase your rate by 20 beats per minute? You can. You can through your breath.
Yes.
And by the same token, can you exert a change in your autonomic profile to shift from an adrenaline focused, very, very sympathetically driven profile to a more vagal, relaxed profile? Yes, you can.
And by controlling our breath.
Breath, exactly. And the few top tips about breath, which I guess we can demonstrate in a video shortly, would be regular, rhythmic. Doesn't need to be very deep, although you can do a deep breath if you want. Ideally nasal, that means in and out through the nose, and definitely ideally diaphragmatic. That means you're pushing your tummy out as you breathe in, because your diaphragm comes down to expand your lungs, and your tummy is being sucked in, so your navel touches your spine, and the breath out as the diaphragm moves up and you empty your lungs with this bellows pushing the air.
And why is that better than breathing as we normally do, just through our chest? Why is it better to diaphragm?
We are not designed. If you look at a baby who's born, they breathe abdominally. They breathe through the phrenic nerve and the diaphragm. It's a very unusual breathing pattern when we breathe through our chest. And in my view, can also explain some of the kind of chest pain syndromes that people get. These are more musculoskeletal than cardiac chest pain. But if you spend your life breathing,
Your
like
muscles
that,
get very
your
tense.
muscles get tense because your shoulder muscles, your rib cage muscles are not meant to be the muscles of respiration, day-to-day respiration. It's your diaphragm. Your diaphragm was designed to give you that muscle of respiration on a deep breath, like when you're exercising and you get to the end of inspiration and to take that extra air in, your chest lifts up. That's fine. But on the regular day-to-day breath pattern, if your chest is moving and your diaphragm and your belly is not, it's not the right breath pattern.
Yeah, and you often say that when you see people, especially people who are very affected by chronic illness or illness, you can spot them sometimes in the clinic when they're not breathing at all, or they are obviously breathing, but their chest wall is moving so
vigorously and actually disproportionately. And there's something called paradoxical breathing as well now, where the opposite thing occurs. The chest wall moves entirely on the breath in, that the stomach sucks in. But this is not how we're supposed to breathe. Our diaphragm is supposed to stretch the lungs down on the breath in, and in pushing down against the belly comes out.
Yeah.
But these patients have learned over time and chronicity of stress to take the breath in out. To take a big breath in through the chest wall, and it lifts and sucks the belly in. And over time, it becomes quite a difficult pattern to break, but quite an easy pattern now to spot in clinic. So that and breath holding is the other marker of stress. Breath holding is a big one.
Why do we hold our breath when we're stressed?
I don't really know the answer to that question, but it's a pattern that is commonly seen in highly stressed or sympathetically driven individuals.
So to summarize, this is great news because we have conscious control over some of these autonomic processes in our body, and we do that through breathing, and we can breathe rhythmically, regularly, and through our belly or our diaphragm rather than through our chest, and we do it nasally, and we can follow your breathing demo. And that can help us regulate our heart rate, which can obviously be helpful in things like POTS. But it can also help regulate our breathing. And we do have another video, check it out, on breathing in POTS and orthostatic intolerance syndromes, but it can help in that.
So I now want to come to the point that Trish was making earlier on about the perception of breath, right, from patients. I mean, you've had a lot of experience on the tilt table test.
I think when, sometimes when I see people the way they have disordered breathing and they're quite tachycardic, and sometimes we use the tilt test as an opportunity to get people to see if they can control their breathing. And they're breathing at 30, 40 breaths a minute. And then I get them to try and control that for 5 seconds in, 5 seconds out. And they find they can do that. But moreover, you can see a drop in their heart rate. But I think when you introduce the thought of breath, I have to be quite clear sometimes, because I think people have been used to hearing that as in, you're just having an anxiety attack, this isn't real, it's just you having, it's some sort of a mental health issue, and therefore you'll just when you introduce the idea of taking a deep breath or using breath work, it's the danger of what people hear the first time is that you say, that you don't think that what I have is real or physiological, that it's just an anxiety. And it's a real misinterpretation, but very, very common one that people have.
Yeah, it's not just a fob off. And of course, to back that up, we know that yoga, which is obviously postural exercises combined with breathing, is one of the few exercises that actually does have good evidence in orthostatic intolerance syndromes that we know of. So yeah, we better all go off and breathe. See you again.